So far, nearly 70 million people have contracted the coronavirus around the world. More than 1.5 million people have died from COVID-19. Millions of others have been hospitalized. But there are also many cases where patients only develop mild symptoms that only last for a few weeks or show no symptoms at all. And then there's long COVID. That's when patients still experience symptoms months after a COVID infection. There is still a lot that researchers don't understand about the novel coronavirus, and the same goes for long COVID. We do know that thousands of people say they've been struggling with longer-term symptoms. Some estimates say about 10% of COVID-19 patients deal with lasting complications. They may include breathlessness, joint pain, and fatigue.
I remember one day I was lying in bed, as I did the whole time, and there was a glass of water on my bedside table, and I was really, really thirsty. And I did not have the energy to lift my arm to get that glass of water till 2 o'clock in the afternoon because it was too much effort. I just couldn't contemplate picking up a glass of water even though I was really thirsty.
Patients are left in pain or unable to breathe properly. Simple day-to-day tasks become massive challenges. And yet, long COVID is not yet recognized as a disease in many places.
I think one of the very big problems that these people face is that they need recognition, they need a diagnosis, they need a healthcare pathway, and we're a bit of a long way off from that still.
So, what exactly is long COVID and how is it different from COVID-19? It can be hard to distinguish between the two in the first place. Experts talk about long COVID when significant symptoms are still noticeable 8 to 12 weeks after infection. The lasting effects can differ significantly from person to person, adding to confusion for patients. Claire Hasty founded a support group for people suffering from long COVID after she found herself struggling long after contracting COVID-19 in March.
I've been very lucky that, unlike lots of people in our support group, my doctor believed me from the beginning. A lot of people were told it was all in their heads, that it was anxiety related to lockdown and goodness knows what that were causing these incredibly debilitating symptoms. But unfortunately, my doctor and those I've seen at the hospital don't know what to do with me.
Scientists trying to get a better picture of long COVID have divided complications into two main categories. There are respiratory symptoms together with fatigue and headaches. And then there are multi-system symptoms that affect several parts of the body, like the heart, the brain, and the gut. These symptoms can be especially puzzling for patients and difficult to cope with. Here's a closer look at what long COVID sufferers say they experience. Initial data suggests that almost all people who have long COVID experience fatigue. In many cases, it goes beyond just feeling lethargic. It may mean feeling too weak to perform even simple day-to-day tasks.
I was unable to get out of bed for several weeks. The fatigue was so debilitating. I could barely lift my head off the pillow. I could shuffle to the toilet, and that was it.
Claire used to cycle 13 miles a day for her work commute. Now she can't walk for more than a few meters and needs a wheelchair whenever she wants to leave the house. While most patients say they experienced continuous fatigue, those suffering from headaches say the pain comes and goes.
Many people in the neurology and neuroimmunology space are starting to think about mechanism and doing MRI studies. And I think the answers that are emerging is that there will be functional imaging correlates of these symptoms where you can see inflammatory events and perhaps begin to work out what's going on.
A temporary loss of smell, known as anosmia, is another symptom reported by people with long COVID. This is not true only for those who contracted the novel coronavirus. A number of viral infections can cause people to lose their ability to smell for some time.
So these kind of things are definitely way up on the list. And quite bizarre things, so people describing very specific smells that torment them. One that I've heard moderately frequently is a kind of concern about smells of burning toast. So the fact that the anosmia, the effects on smell and loss of smell are so profound here really makes you think that the virus must be doing some damage or some inflammatory damage in the olfactory receptors or the olfactory centers. But early days for discovering that.
These include cough, chest pain, and difficulty in breathing.
I went to accident and emergency 5 times over the first 2 or 3 months, but my oxygen levels were never low enough to be admitted. So even though there were times when I was practically crawling through the door, I remember having to sit on the pavement outside because I thought I was going to pass out. But they said, "Oh, your oxygen levels are fine, go home." So I was sent home.
Other common symptoms of long COVID include a fast heartbeat, joint pain, and a loss of taste. Patients have also reported experiencing so-called brain fog. They find it hard to think clearly or focus, and they feel confused or disorganized. Sometimes effects of long COVID are all but undetectable to the patients themselves, and they may be unaware of the damage that's been done to their bodies, for example, involving internal organs.
We found that if we use very sensitive imaging, so this is with cardiac magnetic resonance, we can see inflammation of the heart muscle in a huge proportion of patients. Now, this is a few months from the acute infection, meaning people would consider themselves being recovered. And yet we have seen involvement of the heart muscle.
According to initial data, a number of factors could affect how long patients suffer from symptoms linked to COVID-19. Research suggests that people over the age of 70 are twice as likely to develop long COVID than those between 18 and 49 years old. Data also suggests that in the younger age bracket, gender determines who's more likely to develop long COVID. The risk, surprisingly, has been reported to be higher for younger women than younger men.
Somewhere between 35 to 45, 55, who have been fit and well before, who may have had actually very mild acute infection, but all of a sudden they develop this shortness of breath, tachycardia, meaning heart rate is very fast, so they are nearly in a heart failure, in a standstill, and they are just not the same. And for instance, the pumping function of the heart will be still very preserved, but they cannot increase their exercise capacity, tolerance. They are simply out of breath, just sitting in a chair.
Experts say the severity of a patient's original case of COVID-19 often says little about how they might experience long COVID symptoms.
Whether you get it or not doesn't even seem to correlate very well with how severely you had the acute infection. Because if it was simply to do with how hard you'd been hit by the virus, you'd imagine that the people who'd perhaps been hospitalized, had a high viral load, had a very explicit disease, would be most at risk for this. But that's not really the case.
However, the first week of COVID can be an indicator for whether a patient develops long COVID or not. Those who show a large number of different symptoms in the first week are at a higher risk of long COVID. Researchers insist it's still too early to draw firm conclusions from this data, but tracking patients' early symptoms is seen as important.
This is a story that we're narrating in real time, and we don't know how long it's going to go on for or how it's going to end. So we don't know even if this new disease that we're talking about is a 6-month story, a 6-year story, or a lifelong story. But whatever it is, it would be really helpful if we could spot it earlier and do something to prevent it.
Researchers found that people with asthma were more likely to develop long COVID. Studies into these risk factors and long COVID complications as a whole are ongoing.
we do need a year or two to then be sure what is actually the true long-term effect of it. So absolutely, we do not have this data.
Everything about this virus, whenever we thought we were confident and had it sorted, you remember at the beginning, people used to say, oh, it's a bit like flu, or treat it like flu. Every time, or you can say, well, its nearest neighbor are the common cold viruses. We'll treat it as a neighbor of the common cold. And every time we had assumptions, we were found to be wildly wrong and had to rewrite the textbook. And so it goes on.
For the time being, experts are hoping to draw parallels from similar diseases to be able to deal with patients' symptoms. However, the problem comes when a patient shows different symptoms at different times.
In most countries, our medicine is very clearly stratified into specialties, and the cardiologist rarely speaks to the hematologist, and the hematologist rarely speaks to the respiratory physician, and so it goes on and on and on, and you're either in one pathway or the other, and most of them aren't very good at speaking to each other. So where on earth do you go if you're a patient who in January feels breathless, in February feels you've got heart pain, and in March feels you've got joint pain? There is no pathway for you. So I think we're all obligated to build that pathway.
The lack of a clear diagnosis moved Claire Hasty to launch the Long COVID Support Group on Facebook. It now has more than 30,000 members. She's calling for governments to include people like her in the official COVID statistics, not just those who have died or who have been hospitalized. She also wants health experts to include sufferers of long COVID in policymaking and to take them seriously.
We want to use the term long COVID. We think it's suitably open and doesn't prejudge. I think there's sometimes reference to post-COVID syndrome and language like that, and we think that makes assumptions that we don't think research has given us the answers to yet. We don't feel post anything, so we feel very strongly we want to use that name. We feel very strongly that the patient has to be at the centre of anything. Nothing about us without us is the principle that we're working with.